Atlantic Health Partners is proud to present Week 5 of the Florida chapter of the American Academy of Pediatrics Florida Pediatric Society Legislative Update. To learn how to save on your vaccines, call Atlantic Health Partners at 800-741-2044 or email us at info@atlantichealthpartners.com.
This is a legislative update from the Florida chapter of the American Academy of Pediatrics.
Welcome back to Florida Pediatric TV. This is Week 5 of the 2012 legislative session. I have asked our lobbyist, Sam Bell, to update us. Sam, the Department of Health Reorganization Bill, HB 1263 by Hudson, passed out of House Healthcare Quality Committee this week. I understand that this bill, if enacted, will destroy children's medical services as we know it today. Please bring our members up to date on this frightening piece of legislation.
Well, first, Louis, as you said, this is the 5th week of the session, and we have been watching this bill since before the session when Representative Hudson filed it. What happened this past week is that he offered a strike-all amendment that would substantially modify and we think destroy children's medical services as we know it. Pediatricians in the state of Florida have worked to build a tremendous system, a network of care for children with exceptional health care needs. This system has worked well across the state. But what this bill does is decouple CMS and would set the stage for it to become a separate HMO, and we think begin the destruction of a great system.
Also, HB 1263 would seriously impair the Department of Health's ability to monitor and react to public health emergencies. Can you explain a number of the issues which we as pediatricians are concerned about?
Well, this is the same bill by Representative Hudson that did pass out of a committee this week. In addition to what it does to CMS and to the child protective teams, which is of great concern to us, this bill would shift a substantial portion of the state's public health efforts down to the 67 counties. We think that public health as we know it would be changed, and the state would lack the ability to respond to critical public health needs. It's interesting in this bill that the powers of the department would be restricted to communicable diseases. And when you think of all the diseases that are public health concerns that would not be covered, such as stroke, heart attack, obesity, smoking, and on, you realize how dangerous and short-sighted this measure is.
The various kid care bills have, as expected, not fared well this year. Where do we stand on Senator Rich's bill, SB 510, which would allow kid care coverage for eligible state employees?
Senator Rich's bill has moved nicely. It's in the Budget Committee in the Senate. The House companion, which is sponsored by Representative Elaine Swartz, has not moved. It's in the Healthcare Access Committee, and now we're in the 5th week of the session, and most of the committees will not meet again unless some way is found to amend this measure onto another bill or something that can be done when the Senate bill comes to the House. This measure may be lost for the session.
What about Senator Garcia's bill, SB 1294, which would allow kid care coverage of legal immigrant children?
That bill was filed in the Senate, and there is no House companion. The bill will be heard this week in the Senate, and we believe that it has an excellent chance of passing its first committee. But since there is no companion measure in the House, it is going to be a real challenge to find a way to pass that into law. While it is a good measure that would reach out to many children that do not now have medical service, we're fearful that this measure and the measure involving state employees' children will not pass.
It seems that texting while driving and the booster seat bills are not moving. Do they stand a chance this session?
Well, again, committee meetings are over in the House. None of those bills have moved in the House of Representatives, and we fear that that's going to be the end of it for this session.
Another area of concern are the school readiness bills, like HB 5103 by Coley. What is happening with these?
Well, there's a lot happening, and none of it is really good. 4 bills were filed in the House, all of them attacking the school readiness program. They are being driven by an organization known as FACM, which is the Florida Child Care Management Group. And that group seeks to lower the standards for health care, for school readiness care in the state, and to turn it to a babysitting service, removing quality and education from the system. We're strongly opposing these measures, and we're hoping that in this case the Senate saves the day.
Our biggest success this session has been SB 1172 by Dietert and HB 1285 by Schwartz. What did these bills do, and where do they stand?
Oh, these are great bills. They have two purposes. One is to clarify and define child abuse involving mental or psychological damage rather than physical damage. The second part of the bill is something that the pediatricians in this state have worked for, and that is to require that out-of-state medical experts testifying in criminal child abuse cases must be certified by the Florida Board of Medicine and thus become under the jurisdiction of the board. The Senate bill is being heard this week. The House bill has passed its first committee, and we're hoping that we will be able to hear it in the 6th week of the session. We think these measures have a good chance to pass, and this will be a great step in the right direction.
Are there other bills that you are following and that our members need to be aware of?
We're tracking for the Pediatric Society more than 50 bills. They involve measures such as transition for children with health care needs into adulthood, transition for foster children into adulthood, modifications in children's medical services, and many other issues of a broad nature affecting children and children's health. I'd like to thank many of the members of the Pediatric Society that have volunteered, have offered suggestions on language of bills, and in several cases come and offer testimony to committees. It's with the help of the pediatricians of this state that we can continue to be successful in our fight for better child health in Florida.
Finally, last week our lawsuit against Florida Medicaid reached the end of the trial phase. Pediatricians Lisa Cosgrove, Rob Middlemas, and I testified along with pediatric ENT specialist Dr. Marie Becker. I will return to Miami March 26th and 27th, at which time Judge Jordan will hear oral arguments from our attorneys and those for the state. We remain hopeful that the judge will rule in our favor and order the state to assure that Medicaid children have equal access to health and dental care. Specifically, we hope that the judge will require the state to pay physicians and dentists a sufficient amount and to eliminate the administrative barriers, such as switching and inappropriate loss of eligibility, that further impede our efforts to care for Medicaid children. I'd also like to say what a pleasure it is to work with Sam Bell this session. We're delighted to have him on our team. He's a terrific child advocate. Well, that's it for this week. Please feel free to contact me if you have questions or suggestions.